What's up, everybody? It's David. I'm your host of Highway to Health. You know by now that this podcast is meant to celebrate the people, the organizations that are committed, maybe even obsessed with improving the access, the experience, and the outcomes for our patient community. We've had some amazing guests on the show, and today is no different. I'm excited to introduce you to Nicole Rogas. She's the president of RevSpring. We're going to learn a lot from her, and RevSpring is doing some really cool stuff. I think what you'll learn is that the patient experience is tied to the physician or the provider experience. And when those things come together, outcomes improve. And so, Nicole, welcome to Highway to Health.
Hi there. Thanks so much for having me, David.
Oh, thank you for being here. It's my honor. It's my honor. You know by now, I start every podcast the same way. What's your healthy habit? What do you do to maintain, that mental or physical well-being so that, we can perform when we need to?
Well, I'll tell you, it's a constant iteration for me, no different than the way I take my professional life. But something recently I've been doing is getting up an hour earlier in the morning. So it's summertime. I have two kids, 9 and 11 years old. And in the summer, that means we have less routine. And that means that mama's routine gets thrown off. So working out every morning doesn't always happen. But I do find that 5 a.m. to 6 a.m., I can have a cup of coffee. I can gather my thoughts. That's my time. So sometimes I get on the Peloton. Sometimes I just sit and have a coffee and sit on my back steps. And so that hour for me is the quiet, and it gives me the energy I need then to go on through what is always a 12 to 15 hour day of absolute chaos.
Absolute chaos. We're in the same boat. But yeah, the morning time is where we can get it into. Especially in the summertime, it's nice to go outside. It's still a little cooler.
Well, in Chicago, it's the one time we get good weather, right? So
You've been at RevSpring a little while now. You're not brand new, but I have a question for you. We run in the same circles, right? It's a big industry, but it's a tight-knit community. So you're familiar with, these different companies, even if you're not working there or whatever. Now that you're at RevSpring, what's the biggest misconception about RevSpring from the community, the industry, the people who only know about RevSpring? What's the one thing you've learned since being there that's like, okay, this is different than I expected. This goes against the perception.
It's a great question. And yes, we know each other and run in the same circles. And I think everyone knows me to be really just authentic and real and direct all the time. And so I'm just going to say it. Even when I was contemplating where I would go next, my first thought about RevSpring was that we were a print company, that we printed patient statements, and that's what we do. And I thought to myself, that doesn't feel very sexy or innovative. But in disclosure, many of the senior leaders here are folks that I've worked with in my past and are some of the most innovative, thoughtful, high integrity people I've had the honor of ever working for. And so I knew I went on this learning journey pre-joining and have in the last, 5 months that I've been here, so not that new. That really what we do is about rethinking the entire patient financial journey. It's yes, sure, we do print, but RevSpring truly is a data and analytics company driving incredible insight and technology to ultimately engage a patient in the best way. And so I'm so delighted to be part of this company and to have evolved my own thinking that we're working to involve many in the industry thinking that RevSpring is a really awesome print and payment company, which we are. But we're a heck more than that.
What does that look like in practice? Rethinking the patient financial journey could mean a lot of different things. How does that play out?
Something just about RevSpring's culture that is very real and inherent, and starts with Scott McKenzie, our CEO, is client first. And so what that means is listen to the client, understand what they need, and then bring that to them. Don't just bring what we believe. It's more about what do they need and what do we have to help them solve problems. It's the same thing in we rethink the patient financial journey. There are plenty of businesses, companies that can do a lot of things to actually engage a patient. But what we have that's special to us is we bring personalization to this journey. So we think about this as an orchestrated financial journey, not an episode of care or a transactional communication with a patient. We use analytics and data that's constantly learning from our breadth and depth of customers on where, how, what to engage these patients in a seamless voice, in a seamless tone, through the mechanisms that they want. And so for us, when we think about the journey, we don't think about it as any different than any other engagement that you would have, where you expect, when you're hearing from someone else, for it to be consistent. And so we use that data to drive consistency and uniqueness in the journey.
So if you like text, you get a text. If you like a call, you get a call. If you'd rather an email, you get an email. That kind of thing.
That kind of thing. And then even more than that, right? So depending on how that person interacts in that moment. So we might know, based on demographic data, that you and I, for example, have busy lives. And we know, based on our demographic data or income level, propensity to pay data, ability to pay data, how to communicate with us. And more often than not, we're going to say, engage through text through 3 cycles and then send a print. And in that print, truthfully, even for me, who's a text person, I always have it on my desk. There's something about having my healthcare bill on a piece of paper for some reason, and I know to go to their portal and pay. But we can change as well. So we're as the point I made about constantly learning, if for some reason the data says that we should only be text messaged and only get 1 print, if I don't respond during those first 3 attempts, it can be smart enough to say, well, let me send an email. Or more likely, I'm someone that gets email or IVR, because I get an outbound phone call made to me. I can send a text when those things don't work. So it's not a one size fits all approach. It's constantly iterating based on the experience from the patient into our technology.
This automation, this AI, this intelligence, isn't it ironic that it's making things more personalized?
It will never replace the human being. If used correctly, it is such a great value add, and it's such a great addition to the entire process. So yeah, it's crazy that a technology can make things personal, but it really can't.
I agree. And it should, if used correctly. We talk about personalization a lot in healthcare. It's usually around like the personalized care. So much of the healthcare journey happens outside the walls of the system, of the clinic, of the provider. And so, extending that personalization to that kind of communication and engagement has got to be important when driving engagement and when driving adherence and when driving, continuous communication between the patient and the provider, especially on the revenue or the financial journey. I don't think people realize the amount of personalization that's possible with just normal communication, especially in the financial journey. And you guys are addressing, that need, that challenge.
I say it, and I say it constantly. Like, if you're just in it for money, there are far easier industries to do this in. This is mission based. This is something you all have to feel in your work every single day. But as the population changes, I mean, think about the changes since we were in our 20s and 30s. Like, as the population change, they expect. We've been talking about the retail revenue cycle for 20 years. Like, let's be honest. That's not like some fresh new thought that's out there. The experience we get as a consumer in the retail world, we've wanted in our healthcare financial journey for as long as I can remember. But we're as close as we've ever been, finally, because of the sort of breakthroughs in technology and the passionate leaders and businesses who care about this, to actually be able to do that. My children's care is all in the same community. I'm using the same providers because I want a consolidated experience when I go to the doctor. So my specialists, my dermatologist, my primary care, the kid's pediatrician, the orthopedic that unfortunately my daughter's been to this summer and I have been to, they're all in the same ecosystem. And I can go in, I can see everything. I can manage a pay plan. I can manage my text messaging. Actually, if I want to suppress paper and have only it be paperless billing, I can do it all. And I had to go to the urgent care recently with one of my kids. That's a whole different disparate system. And I got a bill for $14 and there was no way for me to pay the bill online. And I threw it in the garbage. We're as close as ever as being able to bring all of this together, which I think as folks like us continue to age and our kids have kids, it's just going to be an expectation. And So if we don't innovate, our providers can't innovate, and they can't do what people expect. So,
yep, you're right. I mean, the expectation is the same in healthcare now as it is in every other industry, and we have to find a way to meet that expectation. Tell me if this is true. When you're talking about personalization, like in other industries, like let's think about hospitality. You go stay at a hotel and they personalize your experience. It's a bigger lift for that hotel. They have to have more people and more attention to those guests to deliver a personalized experience. But what you're talking about, what reshaping's trying to accomplish in healthcare, is a personalized experience with less of a burden on the provider. How is that possible? How can we do this in healthcare and deliver more personalized experience, a more enjoyable experience, and at the same time, take the pressure or the manual processes off of a health system?
this is sort of the evolution at RevSpring, and in full sincerity, again, being here for 5 or 6 months now, RevSpring has done an incredible job historically of like sending patient communications, text messages, emails, audio, phone calls, print, right? With the evolution of our solution, Engage IQ, it really is the whole mission of Engage IQ is using data to drive a more intelligent, unified experience. I mean, that's really why this product came to market and why it's had so much success. And so when we think about personalization, I'm going to say it again, the tool, the technology is constantly learning. So it is not a static solution. The core culture at this organization is, what are we doing that's new today? What are we doing to innovate today? And we put out solutions in the market that are, as our product teams like to call, skateboards. So they're not a rocket yet, they're a skateboard. And we continue to integrate on that. And so we're able to do things, David, like optimize the outreach, knowing if you're non-responsive at certain times of day. So we can actually tweak the timing of that if you wanted to do that. We also, to make it personal, know based on the financial data we have, what sort of payment plan you need. So today, a health system might have a 12-month payment plan option, right? And that's what they offer patients, 12 months, because it requires more people to manage more payment plans on their side. But we might go, this person will pay in full on an 18-month payment plan. They'll be able to pay the whole thing. They won't miss a payment because the amount owed is right in their sweet spot. So we're using that data to serve up unique payment options, patient financing, payment plans to that patient, so that they're getting an offering that is technology driven to them, but really feels like the provider knowing them, right? The RevSpring brand isn't involved in this. This is the provider's brand to the patient. And so by doing that, then we can bring back to our customers what we've learned. And that might then change their financial policies or other things to actually help ensure and accelerate payment, which they need, simply based on what our tool and Engage IQ has learned about their patients.
When we talk about social determinants of health, this is the biggest social determinant of health. In my opinion. Yes, there's transportation issues. Yes, there's time issues. Yes, there's, general location challenges or geographical challenges. But so many people avoid the health system, avoid care because of the financial journey, and it leads to some big problems. Just Sunday, I saw my brother, and he's a tough guy. He doesn't all those things. He finally goes to the doctor because he's having an issue with his eye. They prescribe eye drops. Well, he goes to pick it up. It's $400. He's like, I'm just not doing that. I'm just not going to do it. A couple of weeks later, goes back to the doctor, and they say, it's still here. It should be gone by now. Are you using the drops? He's like, I'm not doing that. I'm not. I mean, the tube is this big, and you're charging me $400 for it. And they're like, okay, well, let's see if we have a generic version. Okay, we do. We have a generic version of this. It's $180. He's like, no, I feel fine. If the infection's still there, whatever. I feel better. And it's in that moment where, the obligation is on the health system, the provider, to offer opportunities for that patient to get what they need, right? And whether it's an 18-month, 12-month, a generic brand, whatever. But this is the biggest social determinant of health that has really drastic effects on the patient outcome, not just the experience. But then that bigger health event occurrence puts more stress on the system. This might be, this journey, this personalization, these options might be the biggest opportunity in our overall healthcare ecosystem.
Yeah, I agree. And you know what? You and I could sit here and talk for another hour about the cost of prescription drugs, but we won't do that today. But and the coupons available to folks that they don't even know about, but that we need to figure out as an industry and how to educate more. But it is a social determinant of health, and truly, like, the anxiety that people feel as a result of not potentially being able to pay for the medication they need, or in that instance just not seeing the value, or the canceled appointments that people cancel because they don't want to go. They know that they can't pay for it. They avoid follow-up or adherence. And so we do really think about that in the center of what we're doing. And it's part of how we're beginning now to track real return on investment for our clients too. So not only does it do good for the patients, it's also something that helps our providers as well.
We're all connected. And if we can get this part figured out, it's going to help everybody, from the patient to the provider, from access to experience to outcomes. I mean, that's why we're having this conversation today, because these are the challenges that we've got to find a way to improve. And you guys are doing that.
Price transparency too. Just being able to offer transparency through patient estimation on the front end, all the way pre-care, to be able to offer a patient that education of how much it's potentially going to cost up front. Just the transparency of itself has a double-digit impact. And I forgot the actual stat, might be 20 or 25% increase in their adherence to their care plan as a result of just being transparent in the process. So absolutely, that's our goal.
What's the problem with the transparency thing? You talked about, we've been talking about this retail experience for 20 years now, and you're exactly right. We're making improvements there. We've talked about transparency the same time frame. What's the biggest challenge there?
I know. I mean, and the truth is, my gosh, 15, 20 years ago, I think I was at an organization that felt like we were the most innovative thing that ever existed, because we were building a patient estimation, a patient payment estimate. The complexity in it, in my own opinion, as that continues to change. So what a payer pays for, how much they pay, can actually be wildly different, even if you're eligible for insurance. So you and I, we have United Healthcare. Depending on where we get the procedure, the out of pocket can be completely different. Continuously trying to change this and understand it, and then there's all different contractual obligations. And I mean, it's a really challenging problem to solve. But I think as an industry, RevSpring and any other price transparency solutions is as good as we've ever been at it, though, because we know, we gather enough good data from our patients, like their contracts and their charge master and their claims data and the eligibility, and we can create a pretty strong estimate service. But it's never perfect. And then folks want credits back when it's not accurate, when a lot of that isn't in our control. So I think the system itself, David, makes it complicated.
What's it going to take? Is it going to take government to come down and tell the payers to simplify, to streamline? Is it going to take patients to say, you know what, I'm paying cash from now? Like, what's it going to take, you think?
Well, Nicole's opinion of the world.
That's why we're here.
Collaboration amongst folks who are competitors in the vendor world, period. Do you want the government? Sure, the government can help us in a context of like making mandates, but it's never going to really solve the whole problem. It's going to be basic things like No Surprises Act, right? Like, go ahead and put your shoppable services should be up. Yeah, that's awesome. And that was a baby step, right? But if we wait, it'll be, you and I will not be on Earth any longer. and when it actually comes through. I think it requires some of the industry folks, and I'm not going to name any names, but we all know who they are, that have all of the data. And it's going to require, and we're ever going to solve these problems fully, which we're not going to. So if we ever solve them fully, it's going to require us to put the mission of healthcare in front of our margins. And that's a trick, isn't it? Yeah, it is. So we'll continuously work, and I think we will iteratively get better as an industry. Every year it will be better. But I don't know that we ever become completely, we're fragmented. And I don't know of a world where we're not going to have some fragmented components of this entire healthcare process.
The problem is nobody trusts the bill that they get from their provider right now. You take your car in to get fixed and you have some distrust. I mean, you're kind of like, I don't understand what all you did here and why you charged me what you charged me. It's, multiply that by 10 when you get a bill, an explanation of benefits and EOB from your provider. And so what does that lead to? If that distrust is so prevalent, what it leads to is people not paying. And then the provider's challenged, and you talk about margins getting hit. They're getting hit anyway because of this. So I feel for the provider really, because that's their cash flow. And if they can't keep their doors open, they can't do what they are in the business to do. The transparency issue is a big problem.
I find myself often at, a family gathering and somebody's, yelling about their health bill, or, oh my gosh, I had a ER visit. It was $2,000. And then I got this thing in the mail and I'm like, oh, that's an explanation of benefits. And let me explain to you what that means. And these doctors, they make so much money. And I'm like, wait, hold on. Not really. Let's actually talk about how they get paid. And what's happening to them when they're employed physicians. And I think we have to keep spreading and sharing that word and sort of helping people along and understanding it. But you're right. That's why I think ResBring is in such a great, unique position, is it we're able to help our providers be more specific to their patients. Like, we're really working, because if you feel like your provider is talking to you, you're more likely to go back for your care with that provider. But if my provider is amazing and I don't understand my bill, and then the third time I call them and they don't return my call, and then I get a collection notice, I'm so mad that I don't go back there. And so I think it's going to require great use of AI, great use of intelligence to continue to help our providers ensure they can protect that the patients continue to come back to them. It is a competitive environment, like all other verticals now and all other industries, more so than it was before.
Rarely do you hear of somebody express dissatisfaction about the interaction that they had with the provider, like with the clinician. Rarely. You hear about it, and they're not perfect, but the majority of the time when you hear of dissatisfaction, it's because of the scheduling process, the estimation process. Then you have the actual rendering of services, which usually is pretty good. And then, but the dissatisfaction kicks in again after those services are rendered. So the billing, the collecting, the communication, the transparency, the beginning and the end are where most patients complain. And I don't blame them for complaining. There's a lot of opportunity there. I've got 2 questions for you. All right, so you've been at some cool places, Experian, Simpler, now RevSpring. I love talking to leaders because they're constantly growing and learning and evolving. Tell us a little bit about your personal journey and how, these experiences have changed you, have helped you become, who you are today as a leader.
I will say I've been pretty blessed in my professional career. Spent the first 2 decades really in revenue cycle and in a company that ultimately became Experian Health. And I got to be a part of building and growing that company from $25-30 million to what it is today, which everybody knows Experian Health to be. And then, so that journey taught me a lot about change and how I needed to accept change and to see change as an opportunity, where a lot of people are afraid of it, right? A lot of people are afraid of change. That journey in my career taught me that every time something changed, whether it was sponsors of the business, the executive team before I was honored to be part of it, or to become a public company, every change was one of opportunity and innovation, and it allowed people to stretch and to do things that you never would have been able to do before. So I'll say is advice I give everybody is the best place to try something new professionally is where you are. So in the company you're at today, because those people already know you and they know your work ethic. And so I got that opportunity to grow and learn through that. The simpler opportunity was awesome. Over 3 years in a different space in healthcare operations. And I got to learn more of the clinical side around physicians and chief nursing officers and CIOs and how they have to work together, both clinically and with technology. And I will say I had incredible professional growth during those 3 years, learning about integration of many different companies. So during that part of my journey, I learned about how do you take the goodness that comes in any one company, and when you bring it together, how do you not lose that goodness, right? How do you actually just compound that goodness? And now being back in revenue cycle, which I found was my area of passion with folks I've worked with before, and sort of that trust and inherence and how important that is. And I'll say that it's made me, every year of my professional journey has made me a more empathetic leader. It has made me more comfortable and being exactly who I am, authentic every moment of every day, and brutally honest every moment of every day. And lastly, I'll say that I have now learned through this that and I'll say this, I've said this before, and you'll hear me for the next 10 years keep saying it. The core differentiator in any company is the leaders and the people in the business, because it's people. I've grown now to say that my passion is putting people in a position where their superpowers and their strengths can shine. And when you do that and you put a team of people together who are in the right positions where their superpowers shine, you create a company that's innovative and thoughtful and honest and successful ultimately.
I agree on the people part. Our space is so competitive that if you look feature by feature, functionality by functionality, there's a lot of similarities. The secret sauce in companies that I've known to be special are the people and the people that not only, build the product, but support the product and have a vision for the roadmap of the product and the service. And the companies that stick out and stand out, have really loyal fans and customers, are the companies that have the people that are just obsessed with it and live it and breathe it. And if they were to ever to leave, they'd come right back because they're not happy without it.
Yeah, that's right. And it's usually because one of the folks at that company that takes care of you is really the person that made the difference in that technology. Because to your point, and I'll just say that it's like the entire vendor community, like we all are innovating. We're all putting our best foot forward. We're all investing in our technology. We're all trying to listen and do better every single year. And so like comparing yourself to your competition or like going after a competitor, like no way. Like there's room for everybody. Everybody's doing similar things. It's really about how you take care of your clients and how you take care of each other, that you can retain really great talent at your company. That is the recipe for winning in the end.
Agreed. All right, last one. We've talked about access, experience, outcomes. We've talked about transparency. We've talked about all kinds of things. What's the one takeaway? One thing somebody's going to remember from this conversation. What do you want it to be?
What we just talked about. So as a provider, if you continue to look for vendor partners to partner with you, make sure you're acquiring more than just the technology they sell. Make sure you understand the leader's mission of that business and why they're doing what they're doing and where they're planning to grow the company. And so I hope you take away from this call that RevSpring is a great partner for you, and that we do more than print your statements. So
there you go. Here. We proved it today. Yeah. Nicole, thank you.
Thank you. Thanks for the time. I appreciate it.
Good luck to y'all. We'll see you soon.